Hello, everyone. Thank you for being patient with us while we let everyone join. Hi, everyone. Welcome. We're just going to give it a little bit more time, let people join who haven't yet. Do you want to pull the chat up there? All right, thank you so much for being here tonight, everyone, to our first of many VT Reach virtual teleconferences. We will start. Hopefully everyone can join. So this session, as well as all sessions, will be recorded and at the end will be uploaded to a YouTube channel. You can find that YouTube channel by searching VT Reach, and you can have access to these sessions afterward. So that'll be a great resource if you want to refer back to these. And so my name is Jillian Bremer. And I'm Lily Bennett. And so we're both seniors at the University of Vermont, and we're both neuroscience majors and chemistry minors that have finished our pre-med courses and plan on going to medical school. And we wanted to start VT Reach, which stands for Vermont Virtual Teleconference, Reach, Explore, Aspire to Careers in Healthcare, which is a kind of virtual learning experience which we are bringing to UVM. And so this pandemic has obviously limited a lot of the exposure we've been able to get in healthcare centers as students. And so one of the main reasons we chose to go to UVM is because of the great and incredible research hospital and teaching hospital that's on our campus. And even before the pandemic, the University of Vermont has been described to have an oversaturation of learners. And so there are always so many students that want to be in the hospital and learn from all these really eager to teach healthcare professionals. And so this platform is able to kind of bring that together into a virtual setting. So VT Reach was designed to create a new experience where students of all ages, ranging from high school to post-grad, can connect with Vermont healthcare professionals and learn about different avenues into healthcare. So we are excited to host our first session tonight, introducing this program and featuring the journey to and through medical school. And our following sessions, which will, as of now, will continue to be on the fourth Thursday of every month, will follow different mentors from Vermont healthcare professionals with their journey into their profession, along with daily responsibilities, case studies, work-life balance, and things of that sort, and then 2 Q&As in every session. So tonight you will be hearing from 6 medical students from UVM Larner College of Medicine, and you have time to ask them questions into their path into healthcare, and they will be detailing the 4 years in medical school at UVM Larner College. You'll then have the opportunity to hear from the Interim Associate Dean of Admissions at UVM Larner College of Medicine, Dr. Feldman, along with Liz McElhinney, who is the Director of Prematriculation Programs at University of Vermont Larner College of Medicine. And so please keep your cameras and microphones muted throughout this session and ask any questions as they come up into the chat. Lily and I will be monitoring the chat, and during the Q&As we'll be asking those questions that we see the most or are just really great questions in general. And so now to begin, we'll present our first medical student speaker, which is Sadie. And so if Sadie wants to start talking.
Hi guys, I'm so excited to have the opportunity to spend some time with you tonight. I'm Sadie. I'm a medical student, first year at the Larner College of Medicine at the University of Vermont. I am a native Vermonter. I graduated from Champlain Valley Union High School in 2015, so that's fun to be able to continue my Vermont education history, I guess, however you want to phrase that. I did have the opportunity to go away for college. I went to University of New England, which is in southern Maine, and I majored in medical biology while I was there. But my minor was kind of a off-the-wall sort of other. I minored in art therapy, which was a dual minor program between psychology and art. which was really fun. My healthcare experiences prior to coming to medical school, I was an ER tech for 3 years in the main med healthcare system. I also worked as a patient companion, which is a little different, a little bit more hands-off. I worked as a student research assistant my junior and senior years of college, working in a med neuroscience lab, working on addiction and HIV, which was super interesting, very challenging, but a really great experience. I would say my journey to medical school really started when I was a kid, but college and high school classes in particular really sparked that interest. And as you can see there, my MCAT study approach was definitely quality versus quantity. I worked full time while I was studying for my MCAT. And so I didn't have just expendable hours upon hours to study. So finding a time that works for you to study and really focusing your studying on when it's going to be effective versus just studying for 8 hours a day was really my approach to things. And outside of medical school, I like to be as active as I can. I love to snowboard, painting, and art in general. My partner and I, Max, he's in that picture. We go hiking and camping all the time. So it's a little bit about me.
Thank you so much, Sadie. And so moving on, we have Edom.
Hi, everyone. My name is Edom. I am also a first-year medical student as well. Not originally from Vermont like Sadie. I actually did my undergrad at the University of Northern Colorado, where I studied biology with a minor in sociology. So right after college, I was kind of unsure which route I wanted to do. I started getting involved in research pretty early. So I took some time off before applying to medical school to explore that. So I actually spent 2 years at Drexel College of Medicine in a research heavy program. It's called the Medical Science Program, conducting clinical research there. But medicine took my heart still. I still missed being in the clinic. So I decided to apply to medical school after graduate school. My health experiences have been varied, but a lot of them have to do with being a medical scribe. I don't know if all of you know what it is, but you're basically responsible for charting the physician's note. My particular focus was in the emergency department. So whenever we'd see a patient, I would be the one writing up the chart, what the physician found on the physical exam, lab results. It's a good hands-on experience to see how the physician's thinking and what the interactions that they have with other professionals. So I did that for a really long time. I did it all through undergrad and then a little bit during my gap year as well. I was a research assistant for several years. I still do research now. It's something I'm very interested in. So I did that. I've done like breast cancer research, transplant nephrology, currently involved in like delivering bad news to patients and how to do that, especially in patients that don't necessarily speak English, and a couple of other projects. So research is something that I'm very interested in. And then I guess also volunteering was not on there, but volunteering is another thing I did as a healthcare experience. In the picture here, like this was last year while I was at Drexel, a couple of my classmates and I organized a protest because Hahnemann, I don't know, like Hahnemann got shut down, which is one of the biggest hospitals we have in Philly. So we helped with organizing a protest to try and stop it. Didn't work out, but you know, the effort was there. So that was something cool that I did. And I guess my medical inspiration was mostly personal experiences. I'm an immigrant. So growing up in a different healthcare system, you see a very stark difference of how it is in like an underdeveloped country. And I guess the experience I've had from that and then exploring it on my own really pushed me towards becoming a physician. Outside of school, I do enjoy being lazy, which is fine. I like binge watching TV shows, hanging out with my friends, playing video games, anything to kind of distract me from all the chaos of school. So that's kind of me in a nutshell.
Thank you so much. And we're hearing from Grant. And so.
Hi, everyone. My name's Grant Schumaker. I'm a second year, kind of transitioning to the third year, I guess. I grew up in Southern California in Fullerton. And so that's where I went to, that's where I also did my undergrad. I was a biology and biochemistry major with a minor in kinesiology. And I applied to medical school right before I like no gap year or anything like that. I just want to go straight from undergrad to medical school. That didn't work out for me. So I went to Drexel. I did a program, I think, similar to Edom, and mine was only 1 year though. It was really just meant to kind of beef up your application for medical school. And that really helped me because the classes that I took were like basically the first year of medical school. So not only did it help beef up my application, it also prepped me for doing UVM's program. Throughout my undergrad, I did ENT. I worked in like a 911 system and a interfacility transport. They're pretty different. Like one's more fast-paced emergency type stuff. The other one, you're working with patients that have typically like these chronic illnesses, and it's a lot more. I'd say it's a lot more slower. And the medical scribe, I'm sure there could be a few scribes here. I'm not sure, but that's like a typical experience. And then I also volunteered at a hospital. The reason why I chose medicine, I originally wanted a career where I helped other people. And so in my family, we have a lot of fire and law enforcement. So I was sort of inspired by that to pursue that route. But then I ended up I knew I was good at science, or I was okay at science. And I decided to, give it a shot. And I, looked up what I needed to do to become a doctor and what that's like. So when I did my ENT and scribing, those experiences solidified me wanting to go into medicine. And on top of that, like the more practical reasons, like having a job where you'll never, your skills will always be in demand, and it's always secure. My hobbies throughout medical school, I think that the gym has kept me the most sane. I like playing video games. It's really funny. Like I kind of dropped doing that on my pre-med track. And then now that I've been in medical school, especially with the coronavirus too, I kind of like just rediscover this love for playing video games. It's almost like I've regressed into a child, but it's not in a bad way. And I do a lot of cooking. My roommates that I have here are also medical students. We all like to cook together and try like new recipes. And then living in Vermont, we get a lot of good places to go hiking. So that's always fun to do. So that's me.
Thank you, Grant. We can now hear from Patrick.
Hi, everyone. I'm Patrick. I'm a third year med student. Actually, tomorrow is my last day of third year, and then I'll be a fourth year. So I'm originally from Connecticut. I went to high school in Danbury, Connecticut. I went to UConn. And at UConn, I studied biology, and I did this it was a study abroad program in Cape Town, South Africa for like a semester. And out of that, I was a women's studies minor as well, which is actually pretty awesome. It was cool to see, not only like clinical science, but also social science. And then also at UConn, I did a lot with Habitat for Humanity, just like getting involved in kind of a bunch of different projects in the greater Stores area at UConn. I also was on the water polo team, which that was really fun. And then the other thing I did during college was I got my EMT, kind of like what was said before, and I went to Wyoming and worked on at a summer camp in their clinic there, which was also great experience and super rural. And I was driving in the middle of the night to these places 4 hours away to extract kids. It was a really wild experience. Okay, so then I graduated and I took the MCAT, and for the year after I graduated, I worked as an EMT in an ambulance, and then I did the whole ER scribe thing as well, kind of what we were talking about before. And then I moved to LA and did an AmeriCorps program out there, which AmeriCorps, I'm not sure if you're familiar with it. It's basically like Peace Corps in the US. You donate a year of service and work for a nonprofit, and it's basically just do whatever they need. But that was great. And I worked as an EMT in a ER in downtown LA as well. And now I'm here. Yeah, so my inspiration to go into medicine, I was originally interested in it because my aunt was a nurse, and I was just generally she's cool, this seems fun. I am interested in this. And then but I didn't really know much about it. No one in my family else, like no one else in my family is in medicine. And then when I like went to South Africa and did that trip and worked in an ER out there, I was like, okay, this is what I want to do. I want to work as a physician. At that time, I was like, I want to come back to South Africa and be a physician, but we'll see about that. And yeah, outside of med school, I try to keep up with normal people stuff. I run and like hanging out with my friends. I read a ton. I'm kind of boring in the pandemic, like most people, but I have interests that I'll get back once this is all over. Yeah.
Thank you. So next we're going to hear from Flora.
Hi, my name is Flora Liu. I am in the class of 2021, so that means I'm graduating this year, so that's pretty exciting. I'm going to anesthesiology, and how I got here. So I originally grew up in Taiwan until I was about 10, and then I went to a boarding school in Australia from around like age 10 till the end of high school. And then I went to Colorado College, and I did a double major in dance and molecular biology, pretty different there. And then I also did a chemistry minor there. After college, I worked as a medical assistant and / like a surgical technician in a dermatology clinic, and I especially worked with a plastic surgeon. I did that for 2 years. In undergrad, I also worked in sports medicine. I was like the student athletic trainer and the physical therapist aide for the men's soccer team. And I think through those two specific experiences, I felt like I really liked working with helping others, as well as just kind of thinking through the like human physiology and the biology behind it. On top of that, I did some researching undergrad in microbiology, and I also worked in the admission office as a fellow. So I interviewed incoming students as well. And so I tried to do kind of all sort of human interactions, and as well as kind of like the science behind things. And what kind of got me to medicine? So my dad is a doctor and my mom is a nurse. So growing up, I've always wanted to be a doctor, even though I never like knew what that meant. And I think my parents were really encouraging me of trying different things out. So I probably thought about going into like a lot of different things in life. I thought about like stage designer. I thought about becoming a lawyer for about 24 hours. I thought about being an accountant for, I don't know, a week. And I really thought about like, all right, if I couldn't go into like medicine, is there something else that I liked even more? And what really brought me to medicine and decided like this is what I want to do with my life was, I think, the experience working in healthcare compared to anything else I've done. So like, yes, I love dancing, I love performing, but at the end of the day, after a very busy clinic day or something, I would happily come home and yes, I'm absolutely exhausted, but I could lay on the floor and just feel so incredibly fulfilled. And I love being there for people when they need you the most and when they feel the most vulnerable. And so that's why in the end I decided that medical school is what I want to do. And I just want to share with everyone that, you know, I struggled getting into medical school. I struggle with the MCAT, especially. English is not my first language. And so despite that, I still got here and I got through medical school just fine. And so if you're out there struggling, like, it's okay, you'll get here. And things to do outside of medicine that I love. I love mountain biking, skiing, backpacking, anything outdoors. Of course, I love dance as well. So I take dance classes whenever possible. And so anything non-related to medicine is still really fun.
Thank you so much, Flora. And we can now hear from Jess.
Hey all, I'm Jess. I just want to give a huge shout out to Lily and Jillian for setting this up. I think this is going to be really helpful to people who are pursuing a career in medicine. So a little bit about me. I was originally born in Queens, New York, and moved out to Long Island, New York when I was about 5. Then went to undergrad at University of Connecticut, majored in biological sciences and minored in women's and gender sexuality studies, as well as molecular biology. Some things I really like to do in undergrad were a cappella, global brigades, which is when we set up trips to impoverished countries or third world countries, developing countries, to kind of help set up medical aid in those communities. And then something else that I was a part of that I was really passionate about was Students for Gender Equality. Me and my friend just set that up, and it was kind of just looking at the media and how the media portrays women. The reason I think I was inspired by medicine kind of goes back to when I played this video game when I was 8. It was called My Amazing Human Body. And I think it just sort of sparked an interest in science overall. And then I think I realized in high school, that's kind of the one thing I was good at. History was never my thing. Math was hard, but science was always super interesting. And I think because I was good at it, I liked it even more. And it just sort of fed into itself. And I think I didn't know right away I wanted to do medicine, but I think that was definitely something I was considering. And so I sort of shadowed as many people as I could. I didn't have any doctors in the family, so I was more of like family friends or even, people that my own pediatrician kind of referred me to. But yeah, overall, just a love of science and a love of helping people. I think, volunteering also helped a lot. I volunteered at a hospice. So working kind of directly with patients and, kind of echoing what Flora said, being there for people when they're at their most vulnerable was super rewarding to me. So those things combined sort of inspired me to apply for medical school during my junior year of college. So I was able to enter medical school, but I definitely did struggle with the MCAT. I think something that, I was definitely pressured with was getting, that score that everybody hopes for. And I was super disappointed when that didn't come through. But for people who are struggling with the MCAT right now or trying to prep for it, just wanted to let you know, the score, the number isn't everything. And, even if you get a score you're not super happy with, there's definitely still hope, and definitely still apply to medical school. Some hobbies that I like to do outside of medical school to sort of keep me sane are weightlifting, definitely a huge proponent of wellness. So anytime I can be mindful, either with my friends or with my family, is very important to me. Music is a huge way that I can be mindful as well. I love to sing and play guitar. And yeah, overall, just watching Netflix, kind of having my downtime is super important for me to be re-energized.
Thank you. And so we're on to some Q&A. So if anyone has any questions for any of these students, please put them in the chat. We have a couple to start with. Do you want to start? So first question that we had for the students who have stated they were a ER scribe or a medical scribe. If you could just talk about maybe like the training or like what type of experience or like schooling that you might need to be a scribe, just so, if people who are interested know what they might expect in becoming a medical scribe.
I guess I could add to that. So it depends on like which scribing company you have. You're technically like an independent contractor. So the organization that you have a contract with, like for instance, I was with Physicist Scribes, which is now known as Scribe America because they did a merger, I think like a year ago or so. But the company would like train you with their own standards. They usually have kind of like outlines that you need to follow based on like what physician likes what. They teach you medical terminology. So a lot of the training that I had when I did it came straight from the company that I was working with. And then it's like over time you do get like training with other scribes as well who are a bit more seasoned. So you have like a couple of shifts where you're mostly observing / being observed. So they're not just going to like throw you in there like, all right, go fill out some charts. Although we'll get to that point eventually. But I think it's just mostly like knowing the medical terminology, all the different abbreviations that are used by a lot of the physicians or PAs or MPs that you're working with. That was kind of my experience of how I got trained into it. There wasn't any like school you technically had to go to, you just like apply. They mostly are looking for students interested in the healthcare field. It doesn't necessarily have to be med school. You could be somebody who's interested in going into PA school or nursing school, just because they want to make sure that when they do hire you, you're going to have the genuine interest to learn and you're going to do a good job at it, because at the end of the day, it is a service that you're providing as well. So they want to make sure that, you know, this is something that you can stick with.
Thank you. Yeah, so great explanation. So the next question that we received is, do you have any tips for studying for the MCAT effectively? Which I'm sure is a big question and that's something that the two of us have been talking about as we near our undergraduate graduation.
I can put my 2 cents in here. So I think the biggest thing about studying quote unquote efficiently for the MCAT, it really is one of those things that you are gonna just have to dive into head first. You know, like there are so many resources available to you for free specifically to get started with. A good place to start is to take an MCAT, one of their practice exams, or even a free section of it, and kind of suss out how you felt and like what your areas of weakness might be, and really kind of dedicate your time there. You know, you're really smart, you're really capable, so finding times that work for you. I personally could not study before noon to save my life. So I would always study from like 2 p.m. until 5 p.m. and then go about my life. Sorry, my dog's freaking out in the background, but I'm sure there's a squirrel outside. But like finding times that work for you and studying when works for you, and really setting like goals for yourself, frequently checking in, and not putting the pressure on yourself to study endlessly is hugely helpful. People will have as many kinds of study methods as you can imagine, but what really comes down to it at the end of the day is that you have to find something that works for you. And if, you know, you're feeling pushed to do something, but you really know that it's not going to work, like don't do it, you know. Take time, figure it out for yourself, you know, study for as many months as it's going to take for you, do those tests frequently, check in with yourself, see how you're doing. Are you making progress? Are you not? Change things if you need to. So that's as much as anyone can really do.
Thank you. We have our next question. So there's a question about, Sydney asked, I'm interested to know more about doing research while in medical school. So for, you know, all of you who are currently going through it, maybe you could just speak about any research opportunities that you have had or that you know of, things of that nature.
I can do that one. So for us, typically you can do research projects beginning in the first year. I would say probably more like in the second semester, the first year than the first semester, just because it's the curriculum's more loaded then. But usually what happens is people do their research projects during the summer, and you set that up starting in that second semester. And so you'll set up the project and kind of meet a mentor. The school provides a lot of resources for meeting a research mentor, and there's a lot of people that are willing to do it. There's like a whole, you know, fellowship, a summer stipend for it and everything. And then over that summer you start it, and maybe a little bit into fall, and then you can choose to continue on with that research or not. My project specifically, I picked one for my own convenience because I knew that I wanted to really enjoy my summer and I wanted to go back home to California. So I picked one I could do remotely. And there are a lot like that involve using like clinical data and things like that. So you're not really doing any bench research. So that's what I would recommend if anyone wants to, like, you know, do something fun, but also have some kind of summer project. If you're interested in more bench research, I would say like those opportunities are definitely available too. Yeah, I hope that answers your question.
Thank you. Yeah, thank you, Grant. So then another question that I've seen a couple of times or relating to is just in general, what are some good ways for undergraduates to, build their resume, look good for applications, as well as maybe if you have any tips for during COVID in terms of things that you can do for health experience to add to your resume as well for undergraduates, which I know is kind of a tough question with COVID, but if you have any suggestions or tips.
I think I can talk about this one a little bit. Something that I know I did at least was really throw myself into things that I was passionate about. So if it was a cappella, I tried my hardest to get a leadership position in that. So I wanted to be music director because I know that that's something that I could talk about in interviews or on my application. Furthermore, you could also travel. That's something that, people look for, just that you're well-rounded. Also finding like a summer job or working even throughout the school year was also something that taught me like multitasking, but was also something I could talk about in my application. And I think it's something that schools look for, to see that, you can balance multiple things on your plate. But yeah, just making sure that you're doing things that are keeping you well and making sure that you're happy outside of school and you're not putting too much pressure on yourself.
I want to just mention one thing that Jess said that I think is so important to communicate to students, is that doing things that you personally feel very passionate about is the best thing that you can do for yourself as far as applying to medical school goes. Like, there are things that you're going to have to do to check the box to be able to say, yes, I took the MCAT, yes, I took OChem, blah, 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 blah. But the ability to speak to something passionately and have that enthusiasm that only can come about from an actual interest in something cannot be understated. So doing things because you think that it's something that you have to do, or it's going to check a box to get you to medical school, it sometimes is important, but doing things that are just your interest is extremely important as well. So if you're interested in dancing or painting or art or cooking or anything like that, just please take the time to do things that make you feel happy as well. And that will carry over into your applications and be very obvious that you enjoy doing them and are important to you.
Thank you.
I kind of want to add on to that as well. Sorry. Just like as like a practical example, I talked about like EMT and scribing, but what I actually did like pretty much consistently all 8 years between 2012 and 2020 was I was a swim instructor, and I found I was able to talk about that, especially in my interviews. Sorry, I'm trying to do not disturb my computer. Okay. I talked about that more in my interviews and reference experiences from that rather than like my EMT and scribing job, because sometimes I just felt I could speak a little bit more passionately about. So just kind of echoing that sentiment of doing things that you're really passionate about, and then don't be afraid to talk about those in interviews, especially.
I kind of wanted to add onto that and kind of answer the next question about like, what should you major in, what should you study in undergrad? And I think that really also relates to do what you're passionate about. If you're passionate about like political science, like do that. If you're passionate about geology, do that, because if you end up going to medical school, you'll never ever have the opportunity to study rocks ever again. And I think medicine, yes, it's a lot. There is so much science behind it. Yes, you have to do all the pre-med courses, but medicine is also about like treating humans, and there are so many humans out there that have a lot of different experiences than what you think of like a physician's experiences. So any experience you can do that's outside of medicine that you're passionate about is so helpful in becoming a physician. And as well as, this is a journey. This is not just like, all right, like I'm getting to medical school next year and like I'm like home free from there. It's about doing something you enjoy, and it's about the daily activity of how you end up getting to where you end up in 10 years.
Thank you so much. I feel like that's such an important point.
Yeah,
And we have time for one final question for right now.
So for our last question, for those of you of the medical students who took gap years, could you just speak about how you feel that helped you on your medical school journey, or just like the pros and cons about those gap years that you took, and if you think that it helped or you could have done without them?
I can talk about that because one, I haven't talked yet, and then two, I took 3 gap years and I loved all of them so much. So I stayed home for a year and I had a lot of like personal stuff going on that I had to like attend to in my family. So I dealt with that for like a year, and then I moved to California and like did my thing, and I sowed my wild oats, and I got to move to LA, and I never would have gotten to do that before. And I like really experienced what it's like to just like pick my life up and move to a place where I don't know anybody and I don't know anything, and I just like kind of wanted to be like figure out how to be a real person is what I can say how it was. Like I feel like it made my adjustment to medical school way easier because I had already put myself through something so stressful that I had absolutely no idea what I was doing, and I just kind of like threw myself into it. And also I had to do a lot of personal growth. And also like I am very much like under the mindset that like I have the rest of my life to be a doctor, but I had like only a few years to be in my 20s, and I didn't really want to just go right away and spend my like 20s just doing this thing that I'm going to do forever. So yes, 100% recommend it. I really don't think I would have been able to handle the rigors of medical school without it. I think Jess said that she went straight through, and I like, that's awesome. It just wouldn't have worked out for me.
I also took a gap year before grad school. I think one thing to keep in mind is it's okay, you don't have to rush into it. Applying to medical school is a very stressful thing, and it's very expensive. It's not cheap at all. So if you need the extra time, like I was paying everything myself, so like I needed to save money. I was also feeling pretty burnt out right after college. Like I don't know if I would have been able to perform as well academically if I just went straight from like 4 years of college straight into like medical school or grad school, just because I knew that my headspace was in there. So I just kind of took the time off to really just work full time in the ED, kind of do whatever, travel. So it's okay. Like you don't have, like you shouldn't feel pressured to apply straight into med school because you're going to burn out pretty quickly. And it's okay to like take your time with it, since it's not like an easy decision that you should enter lightly. So yeah, I mean, age doesn't matter at this point. It's kind of like just take your time with it.
Thank you all so much. And so I think we're going to move on for right now to talk about really what you're all going through, the journey through medical school, and just to spend a little time talking about what each year really entails. And so we have the first year, if you want to start.
I can pop my thoughts in here. Edom and I are both first years, so we're both kind of in the trenches of preclinical years together at this point. First year, I think, is interesting because besides the fact that you feel a lot of like changes in your life between moving and like meeting all of these new people, starting on this like new career path that you're going down, like you also have a lot of new learning in how you balance your own life. You know, something that I struggled with the first like probably 2 or 3 months of medical school was like taking a step back and like being appreciative that I was there. You know, like the trip to medical school and the journey to medical school is so long, and then you get that acceptance and you're so excited and you're like, oh my gosh, I can't believe it's happening. And then you show up on your first day and it's orientation, and I was late to my first day of orientation because that's everyone's nightmare. But it was fine, and I just got a little bit overwhelmed, and it took me some time, and somebody saying, you know, Sadie, you need to take a breath and like look at the situation you're in, find some space for yourself to like feel gratitude and like feel the appreciation for where you are. The school stuff you can do, you know, you've shown it through high school, you've shown it through undergrad, you've been accepted, like you can learn the material, But I think the big thing that you have to work on as an M1 is balance and finding your own stride and taking the time for yourself to be a human being outside of medical school. Especially with the way that COVID has changed our lives. It feels like the work hours are no longer like a 9 to 5 or anything like that. And that's definitely true still in medicine and in medical school. Like I've been really having to set firmer boundaries for myself and like trying to go to bed before, 11 o'clock every night, getting up at certain times and like taking the time to go to the gym and taking the time to hang out with my friends. Like that was something that really was a transition turning point for me in my M1 experience, was taking a breath.
And just to touch on like what to really expect your first year, there's a lot of heavy focus on basic sciences. So like your first semester is typically like biochem heavy. The way I kind of sum it up is like 4 years of pre-med crunched into one semester and then add anatomy on top of it. That's pretty much your first semester. It's probably the worst one so far, at least from my opinion. And they mostly just focus on hammering in like just the basic concepts for you to do well later on. They do have a lot of opportunities to kind of see that in action, especially in your second semester. We do this thing called like doctoring in Vermont, where early on you get a preceptor, a physician that you work with. So you'll be studying something in class and then you get to see it actually during DIV. So like right now we're in the GI block, and recently a lot of the patients I happened to see also had GI problems. So you get like a really good hands-on experience through that. And even like with UVM's curriculum, it's very active learning heavy, meaning that it's not traditional lectures. We do have some of them here and there, but for the most part, there's a lot of emphasis on like applying what you're learning and you're not just kind of like rote memorization. So usually we'll have like assignments given to us, like readings, and then we meet together in little small groups and kind of discuss through them like case studies. That way what we've studied, we apply the next day and do it all over again. That way the information sticks better. So there's a lot of teamwork. There's a lot of opportunities to lead sessions. There's a lot of opportunities to work with others. So it's a very like well-integrated curriculum to kind of apply what you're learning and you're not just kind of like memorizing it on your own. But it's definitely, your first semester is probably the worst one. And then it gets better because things start to get a little bit more interesting. You're getting into pathology, you're getting into the clinic. So after your first semester, it's a bit more clinically oriented.
Thank you so much. That sounded really great. So we're going to move on to year 2, which is presented by Grant.
Okay, mine is kind of short. So yeah, you keep from in year 2, you continue doing foundations like the whole preclinical curriculum. I think you start a public health project, but I think that they actually moved that to the first year. So that's part of it too. I'm trying to think what else we ended up doing outside of it, because most of it is step studying, really. Like it was hardly curriculum oriented. Like you're balancing trying to pay attention to what's important for UVM and what's important for school, but then also trying to study for STEP as well and trying to figure out like what's the high yield for that. That problem will probably go away though by next year because of the STEP going pass fail. So you continue through foundations. You do another class at the end called convergence, which actually was really cool. You are in groups. They did this through Zoom, and you're just in a small group, and every day of the week you get like a different patient, and it's kind of like you get like a presentation. You ask like what questions you would ask the patient to try to get more information, and it's sort of like taking you through an experience of how doctors sort of like problem solve and get to like a diagnosis, what labs they order and things like that. So I think that kind of builds like your teamwork, and you kind of go off of medical knowledge. And UVM really likes active learning, and part of that is recalling information. So we can't use any notes or anything like that. So everyone just kind of collectively uses their shared knowledge. And if you do have a question that no one knows, then you like make that like a question, and the next everyone kind of does like a little research on every question, makes a presentation, and then you talk about it on the next day and try to use that information to help build like your knowledge about the case. So that was interesting. Then after that's all done, you get a I think it's like 6-week dedicated study period per step, and then you're done. I was I just took step like maybe it was like what 7-8 days ago now, and so I'm still kind of recovering from that trauma. So hopefully it'll be okay. I don't know. But after that, now we're in like our clerkships orientation. And clerkship and clinical, it's kind of like the same word. We'll start that, and that will continue on for the rest of that year. So it's kind of like this. Now we're in like this weird transition point between you're still like in your second year technically, but now you're like in the second level. Sorry, my cat's like going. But yeah, that would be the second year.
Thank you. And so now we get to hear about year 3 from Patrick.
Okay, so third year, like I feel like talking, when I explain third year to my mom, she gets very confused on like what I'm doing. So I apologize if this is confusing, because it is confusing. But basically, and then I'm going to talk about it as if COVID wasn't a thing, because COVID kind of screwed up our third year a little bit. But basically you get broken up into flight groups, and your flight group is this like group of, I think it's like 12 other people, where you all do the same rotation together. So my first rotation was neurology. So me and the 12 other people that were in my flight group, we all did neurology together. So we were assigned to different services and different doctors. There's like there's like an inpatient neurology service, a consult service, a stroke service, and then something else. And you basically get assigned to these like little teams, and then you work with that doctor and those residents for the week or something. And then go around the hospital, like work with your patients, try to, you like help just see how they're doing. You do an exam, you try to create a plan for what is going to be happening moving forward. If that person needs to go to a rehab, if that person needs to, can go home soon, if they need antibiotics, whatever. So that's like kind of like the inpatient, what you're doing while you're actually on that service. You get your own patients. So they'll kind of assign you like the first day. Grant, this is helpful for you to know too. But like the first day or whatever, they probably will give you like 1 or 2 patients that they'll just say, all right, so go into the computer system, read up on them, and then you can go chat with them in the hospital. So that's what's really cool is, Grant is going from sitting at his computer all day, studying STEP, to now getting to go and like be around patients and stuff. And that's kind of like what we're all here for. So that's the general, like that's one. So then you finish neurology, say, and at the end of each rotation, you have to take this exam. So all the way through the rotation, you're studying for the exam. So that's kind of, I would say the hard part is balancing not only working all day, like neurology, I think I worked like 7 to 5, but then coming home, like doing exercise or cooking dinner or something like that, and then studying at night just for these exams. So that's, I would say, the hard part. The easier part, I would say, is while you're at the hospital, because it's so fun and engaging all day long. So neurology, there's like a primary care, like an outpatient medicine, there's family medicine, psychiatry, pediatrics, OBGYN, surgery, and internal medicine. And I would say like the grand scheme of things, like your day-to-day is pretty similar. Like you're going and you're assessing patients in the hospital, kind of like coming up with a disposition plan for everyone. The thing that's different is that you're constantly switching teams. So you're constantly switching between the attending physicians and resident physicians, and then you're also constantly switching different services. So, going from psychiatry to OBGYN is just, they're completely different services. So you're just doing a lot of different stuff. But it's really fun. And I feel like I haven't slept in a year. But tomorrow is my last day, and it's been really cool now that I think about it. it can just be pretty exhausting, like I said, with the testing, like having to take all these tests. But that's what we're here for, is to just keep learning. So yeah, you can ask more specific questions in the chat if you have them.
Thank you. That sounds really great.
And congratulations.
Yeah, congratulations on almost being done. And so then we'll move on to the final year, which is going to be presented by Flora and Jess.
All right, I have good news for you, Patrick. Fourth year is the best year. It is so much fun. And fourth year is basically, I like to think it's whatever you want to make out of it. So in general, there are about 5 requirements for fourth year. And so that is, you have to do an acting internship. So basically they treat you like you're an intern. So you have a heavier workload than when you were like a third year. You have to do an acting internship in a specialty of your choice. So many people would choose to do in the specialty that they want to go into. You have to do an acting internship in internal medicine. And so that's kind of like the bread and butter of medicine. You have to do a acting internship in surgical, or just do any actually surgical subspecialty for 4 weeks. You have to do emergency medicine, and then you have to do a month of teaching or scholarly project. So that could be research as well. And so after you fulfill those 5 requirements, many students will also choose to kind of explore different specialties if they haven't already chosen what they want to go into yet. And then on top of that, I think what's really the most wonderful thing about fourth year is it's a time for you to decide where your knowledge gap is, and you get to choose out of like 100 of elective and to fill your schedule with. And so you can take a lot of different electives in different departments that you didn't get to rotate in during third year, or you want to know more about something that you like just didn't really get to see. So that's why fourth year is super fun. And you do take step 2 of the exam, usually at the beginning of your fourth year. And that is much better than step 1 studying. And a lot of time that is kind of asking you question about what is the treatment for this? How do you diagnose this disease, and what is the next step? And so studying that was really fun, to kind of like, well, this actually get to use this sometimes in the clinic, and what I see in the clinic helps me in this step exam. And then I'll let Jess talk about the really, really exciting part.
Yeah, so that was an awesome like recap of pretty much the requirements that are asked of us in fourth year. And it sounds like a lot, but it's really manageable. I'd say fourth year is the best year, but maybe I'm saying that because I'm really checked out. But basically, fourth year is where I decided that I wanted to go into anesthesia. And huge shout out to Dr. Bridget Mariquin. I like owe my entire decision and my entire career to her, because she convinced me about this career and kind of sat me down and talked to me about it. So fourth year is the year you really get to explore, all these things that you didn't really get to see in the hospital. And since we don't have a core rotation in anesthesia, it was sort of an elective I had to take separately. So that's a huge thing that you get to do fourth year. Another thing you get to do is apply to residency, which is super overwhelming at first. But really you apply geographically, or you're interested in specific programs, and it gets easier as you do it. Then you interview, and coronavirus definitely threw a wrench into the works for interviews. All of our interviews were remote over Zoom, so like this. But you kind of adapt to that as well. I think everybody who gets into medical school is pretty good at adapting and thinking quickly on their feet, so it works out. And then you have match day in March, and you decide, or you find out where you're going for residency, and then you graduate in May. So it's really just a year of hard work that leads to some big accomplishments, big milestones, and celebration, and sometimes a lot of free time. my second half of my fourth year, you get to choose, it's very flexible what you want to do. So I wanted to come home, spend time with my family. So I got to do a lot of remote reading months to kind of decompress before intern year. And, you can also choose to do electives that you haven't seen before. So I have friends who are doing endocrinology, friends who are doing palliative care, and really, really cool things that you may not get to see otherwise, in your future career in the hospital. So definitely a year of exploring and a year of excitement.
Thank you all so much. Again, that was so fantastic and exciting to hear about. And so we're going to move on to our next segment of this presentation almost. So it's going to be kind of what makes a really good medical candidate. So now speaking is going to be Dr. Nathalie Feldman and then Liz McElhinney. So they will be talking just about some of the admissions process and what can make a good candidate and what they search for in applications and students.
Great. Thank you very much, Lily and Jillian. It's really an honor to be here and to meet you all. Thank you for coming. Thank you for organizing this and for inviting us. It's really encouraging for me to hear also the reflections from all our students, because essentially their testimonials speak to exactly what Liz and I hope to share with you today. They are examples of what wonderful medical students and future aspiring physicians look like. Namely, and many of them have mentioned this, what we talk about in admissions as very much what I like to refer to sort of as an inside out process versus an outside in process. And what I mean by that is, again, echoing what Sadie, Jess, Grant, and so many others have said, which is to find really what you enjoy doing and carrying that to its very fullest, and trust that that will lead you to the career path that's intended for you. And so I think we have a tendency to sort of think about what others may be looking for and trying to sort of morph and transform ourselves to reach that goal. And I think what our students have so beautifully exemplified and described is really to trust that your passion, if you exercise that, that will lead you to the career that you're interested in. Yes, there are some prerequisites, which Liz will talk a little bit about just in terms of courses you need to take. But again, to the point about what academic prerequisites would look like, they're just some basic pre-medical requirements that you can either take in your undergraduate years, or some students who haven't taken science in undergraduate, or those prerequisites in undergraduate years, can take a master's degree and fulfill those requirements after they graduate from college as well. So Liz, did you want to talk a little bit about just sort of get the basic course requirements out of the way, and then we'll talk a little bit about holistic admissions, and I'll describe exactly what we mean by that and how we assess candidates for entrance into our medical school. Liz?
Hey, thanks, Natalie. Yeah, I must say what we planned to say was a lot of what we heard from the students. So it was beautiful. So our requirements, and this is so you can, as Dr. Feldman said, do this during your undergrad, either in a science related major or something completely different, as some of our students said, or afterwards in a master's program, or even in a post-bac program, which is not a formal necessarily like degree granting program, but a kind of a program where you take courses kind of ad hoc as you need them. So our requirements are 2 semesters of organic chemistry with lab, 2 semesters of general chemistry with lab, 2 semesters of biology with lab, and 2 semesters of physics with lab. And then we recommend courses like biochemistry, statistics, and then other general requirements like that aren't requirements at our school, but you may see at other schools, like English, an English course. Some schools like to see a psychology course, things like that. So you'll want to check each school that you're planning to apply to make sure that you are meeting their requirements, but ours are just those 4 core courses. And then of course, the other academic requirement is taking the MCAT.
Okay, and so that is the academic or the metric part, but let's pause a little bit and talk a little bit about what does holistic mean. So first, that word is kind of an interesting word because it applies to the care of patients too. So we use the word holistic medicine as well, which if I describe to you how it's used in medicine, which is really characterized by the treatment of the whole person. So taking into account all the aspects that a patient might bring to you as you're trying to sort out of diagnosis, that holistic care of patients, the emotions that they may be feeling, the social factors that are influencing their health outcomes, rather than just the symptoms of the physiology of the disease, that is holistic healthcare. So if we apply that model and that same word to holistic admissions, which is what Larner College of Medicine does for medical school entrance, does anybody want to take a guess from our guests who are attending here tonight? What holistic admissions? So if we're thinking about the whole patient care for holistic medicine, what do you think we mean by holistic admissions? Anyone want to take a guess? You can write it in the chat too if you don't want to unmute. Any guesses?
I would say,
yeah.
Oh, sorry. I would say that you look probably beyond like the quantitative data that makes up a person.
Excellent. And I saw also typed in the chat, diverse experiences. So absolutely, I think if we advance the slide once, it might show a graphic. There we go. Exactly, experiences. So that's right on. So experiences, attributes, and metrics together compose that holistic model. So MCAT, so some of our students talked a little bit about how sometimes the MCAT can be challenging, but for the Larner College of Medicine, it's but one component of our holistic admissions picture. So that's the metrics part, but that by no means is the only part. It's not counted any more weight than other attributes or experiences that candidates might bring. So this is a graph of what holistic admissions looks like and that we sort of follow with regard to assessing candidate files. So it's really flexible, it's individualized, and it's a way of assessing applicants equitably across the board. So the experiences would be things like the path taken, right? The context that led a particular student to a career path in medicine. So that's all taken into consideration. The attributes are things like qualities or characteristics of that individual. And then of course the academic metrics, which is what a lot of people focus on. But again, with holistic admissions, there's so much else to talk about. And that's why I think the advice that you got from the students about following really what makes you tick, what you're passionate about, is bound to lead you in the right way. So when all those things are considered in combination, then we think about how that individual applicant might contribute to our medical college in addition to their careers as future physicians, contributing to patient care, research, or other avenues that their career will lead them to. So any questions about that to start? Because we're going to switch over on certain core, what we call competencies that we look for in each of these categories of experiences and attributes. But any questions? Are any valued more than others? It's a terrific question. And the answer is no, they're equally assessed in the context of the broader picture. So that's all about holistic admissions.
And we did have another question in the chat regarding online courses, and I just want to address that verbally in case folks aren't looking at the chat. So we have always accepted online courses. And I know a lot of our colleagues at other colleges of medicine who didn't necessarily accept them before did make an exception for if you were in a course during COVID, you know, whether it was when it hit back in way back this time last year, or if you're taking it now and it's partially online or fully online. Again, you'll want to check with each college, but many, it's hard not to be able to have to accept those right now. So I think you'll find that a lot of folks are taking those online courses just because of the situation.
Great. Thank you for clarifying that, Liz. And I will say too that no individual student brings the same degree of balance between each of these elements. So different experiences, different paths taken. One of the aspects that the Larner College of Medicine really focuses on too is that diversity of experiences actually enhances our community. And so no two paths are the same. So don't feel like you have to, say you have a friend or an older sibling who's taken one path to medicine that need not necessarily be your path to medicine. So again, diversity is the driver of excellence. And so that is also taken into consideration in terms of really looking at all these things to bring to bear to your ultimate experience as a medical student at the Larner College of Medicine. So these are some of the core competencies. In other words, the things that we look for in the reflections that we ask you to write. So when you write about your experiences on the application, we're looking for things that tell us, and again, back to the point that the students shared with you, is when that passion comes across for a cappella singing, for example, or for dance, that's translated in the way that you're describing your experience. And so that's that kind of reflection you're much more apt to be able to easily write about if it's something that you're really passionate about, as opposed to something that you might have done just to try to get into medical school. And so again, that reflection is going to be much more significant, I think, if there's you're talking about things that you enjoy talking about or writing about in your reflection piece. So these are some of the competencies that we look for, both in that reflective writing and the short essays that you submit in your application, but as well on the interview. Things like service orientation. You heard many of our students talk about how committed they were to community service. So demonstrating that desire to help others, that really comes across in a lot of the experiences that some of our students share. Sensitivity to others' needs. And again, you heard our students talking about that. Social skills, right? Being able to be aware of other people's needs, goals, feelings. Cultural competence, really seeing things from multiple perspectives and recognizing one's own biases and how that might inform your conversation with someone or with a future patient. Teamwork, hugely essential in the way we provide care. And so we put a lot of emphasis on looking for that competency in terms of your activities. Doesn't mean you have to be on a sports team. It's just, it could be the way that you've incorporated some kind of teamwork in whatever activity that you've enjoyed doing or experiences that you've been involved in. And then these are a few others just in terms of oral communication skills that comes across in the interview setting, ethical responsibility, reliability, dependability, resilience, adaptability, and then lastly, capacity for improvement. So really engaging in a reflective practice for improvement. So that brings up a question that we're often asked, which is, what if I have a bump in the road, right? I fail a course, or I have an institutional action at my college. Is that it? I mean, is my chances of getting into medical school done? And the answer I'm here to tell you is no, absolutely not. Why? Because one of the core competencies we're looking for is capacity for improvement, right? So if you can reflect on that experience, what you learned from it, how you grew from it, that in and of itself is very telling for one of the core competencies. Everybody makes mistakes. Being able to talk about it, share it, and share how you grew from that experience is something that, you know, is, like I said, one of the competencies that we look for in an applicant. So I'll stop there just for a minute, just to see if that triggers any questions that anybody might have. Or Liz, if you wanted to add any.
We've had some questions in the chat about virtual experiences.
Yes.
Which is what we're doing right now.
Yes.
And questions specifically about virtual shadowing. And I think, the response that I put in the chat was, if you're finding that you're learning from that and you're getting something out of it, then please go for it, do it. You will want to make sure you can explain it well to the admissions committee, since they won't necessarily have seen that before. And I think I would broadly apply that to many of the experiences that you might be having over this past year and in the coming however long that will be apart physically from each other, is just to make sure that you are demonstrating to the committee the impact that it had on you, how it connected you to the community, and what you were doing also, because sometimes these are going to be new experiences to them, so they'll want to know a lot about what you were doing and how you found that opportunity. Someone was asking how to become involved with virtual shadowing, and I personally don't know, but what I was going to say is that if you can't find virtual shadowing, just find another way to be involved with your community. And earlier on in the pandemic, we heard from a lot of folks who were like making masks and distributing them. And while that may not be necessarily, folks generally have their masks at this point, those types of activities are also worth something, and I would encourage you to get creative if possible.
Yeah.
We have some more questions here. Oh,
great. And there's some resources there for shadowing, but I think, again, especially with the pandemic, when it makes it a little bit more challenging, or a lot more challenging, to be able to have in hospital or in clinic exposure, is to think creatively about opportunities to serve in your communities. It could be, we've had students, provide brief exercise classes for infirmed patients in nursing homes through Zoom, for example. So that's a way to connect with patients without necessarily having to be in the clinical setting. So to think creatively about ideas like that, brainstorm ideas with friends about something that you're passionate about, that you'd like to sort of create as an opportunity, then again, those are often really, really fun and provide a great community service as well. And then, of course, we have Lily and Jillian to thank for a virtual shadowing experience, and some of the series that they're planning for the future. I think you'll be able to acknowledge that as one of your virtual shadowing experiences as well.
Yes, that is the goal of this, and as we will definitely mention again, we do have a second session planned in April with Dr. Mariquin, who is here with us tonight to highlight her healthcare profession, and she's in anesthesiology. So definitely a very hopefully similar experience to some of these other virtual shadowing resources. That is a big goal of Jillian and I, is to move forward with this project and these sessions.
Jillian, I was wondering if I could just say something really quick that both Dr. Feldman and Liz really brought up in my mind. Something that I want every pre-med student, anyone aspiring to medicine, to know, and really know, and if I could go back and tell myself this a million times, I would. There is no one prescribed way to be a doctor or a medical student. This is a career that you find in yourself, and whatever way you feel you can do it best is the best way you can do it.
Yeah.
Whatever path you take to medicine is the right way. Whatever way you practice medicine, while meeting all of those necessary aspects of being a physician, is the right way. And there's no rules as far as who you can be in medicine. That's something that I never knew. There's no one medical student. There's no one right way to be it. So being you is the best way that you're going to find yourself in this field. So take that to heart and know it. And if you're feeling a little scared or nervous that you're not the right person to be a medical student or the right person to be a doctor, just put those worries to the wayside, because they're not real. It's absolutely not going to be something that you struggle with.
Yeah, thank you very much, Sadie. That's
very well said.
Yeah, very good advice. I mean, we've had medical students enter after a whole other career in finance or in accounting or other specialties that then make that decision. So there are so many circuitous paths. So I would just echo exactly what Sadie was saying there, is to really, and to take advantage of, some of you may have pre-health advisors in your colleges. They're an amazing resource for encouraging you to find that path that fits for you, and review, some of the questions that you might have. And certainly you can reach out to us at any time as well with any questions.
Yes, we have Kara Calvelli in here as well, who's helped with this project so much and is our fantastic pre-health, one of our pre-health advisors at UVM. And when I was, we're seniors now, but after my freshman year, I remember meeting with her and saying, well, I'm so stressed. I feel like I need to be doing healthcare things, but where I'm from, I really love waitressing in the summer. And it's something I really have always enjoyed and like a lot. And she went through the core competencies with me and said, okay, you learn every single one of these, like teamwork, communication skills, service, like you get to do all of those things while waitressing, which is not medical based. And it's just a reminder that there are so many ways to get to where you want to be.
Wonderful. What a great example.
Well, this is such a gift that you guys are giving to get exposure, because that is also what is so hard to get. And so I'm really grateful for this opportunity. And I'm here for you UVM students if you need an advisor. And my colleague, Nick Celedon, is on the line too. And he is our newest pre-health advisor. So
wonderful.
If you are UVM students, definitely take advantage. Both of them know exactly what they're doing and they're extremely helpful. And I've met with Kara as well, and it's been extremely beneficial. So.
All right. Well, if we have any final questions, do you want to ask them?
Yeah, so definitely if you do have any more questions, we have a couple minutes left in this session before 8:30. So feel free to ask any questions to the med students or to Dr. Feldman and Liz. Feel free to type them in the chat and we can try and get through the ones that we can.
Yes, and we just did want to say our special thank you to everyone who's helped us get this first session off the ground. It has been a really quick turnaround from when we were just sitting with this idea. We were doing a virtual shadowing session ourselves and said, well, it was based out of Texas. And we were like, there are so many incredible advisors at UVM, and to have that local connection. And so that is why we are here today, which is incredible. And next session, you will be hearing from Dr. Mariquin, who we actually reached out to. And so that is where we are now. And so we'll get to hear about her journey from obstetrics to anesthesiology, and it will be a really great talk. So I'm excited for that.
So we do have just a couple more questions. Maybe some of the med students can answer, like living situation. If you want to just quickly speak about that.
So it's kind of like similar to college, to be honest. There's nothing really special about it. You have the option to either live with your classmates or other upperclassmen. That's usually kind of the case. You could also live by yourself if you want your own space. There's not like a LCOM affiliated housing like some other medical schools. So you just kind of have to seek it out. And the good thing is it's a college town. So like there's many people like moving in and out. So a lot of people just kind of like room with each other. I think that's kind of the norm, just to like save some money.
Yeah, I use the UVM off-campus housing website, and you make like a roommate profile, kind of like talking about yourself, where you're from, and then other like practical things about having a roommate, like the number of bedrooms and stuff that you want, and then like the how clean are they, do they party, are they people that smoke and things like that, so that way you can kind of find a good match, and that's how I found the current roommates I have.
Sorry
about that. We were muted.
Forgot to unmute. But the next question was, how many medical schools did you all apply to in total?
Apply to, I would say I probably filled in like maybe 15 primary applications, but then following primary, there's secondary applications, and I would not suggest applying to as many schools as I did if you don't plan on filling out the secondary applications, because I filled out a bunch of applications and was like, oh my gosh, I don't want to go here, and didn't fill in the secondary applications, which can be quite a drain on your budget. So I think it really is one of those things that you have to figure out how much you can spend on medical school applications, because it is very expensive. You have to pay for the primary application as well as the secondary application. And years going forward, you also have to factor in the cost of traveling to interview. So if cost is something that you have to consider, taking the time to plan out schools that are going to be a good option for you, that you have a solid chance of getting into and that meet your educational needs. Personally, I applied to schools that focus more on active learning, because I can't do lectures very well. Like, it's just not my learning style. So I focused on schools that offer the active learning curriculum. But taking the time to do some research on those schools before you apply is huge. So people apply from anywhere from 1 to 30, but it's all a very unique situation. I think usually like anywhere between, like, correct me if I'm wrong, like 8 to 12 is the average.
I think it's 20 or something like that, actually. It's a lot higher than that, but I was gonna interject on that. So there's actually a financial way you can kind of manage that. I applied, so my primaries was like 25 schools, and then I think I sent like 18 secondaries. That's kind of usually what turns out. I'm actually gonna put on the link, there's this program called like the Financial Assistance Program, where if you apply through AMC, they can actually give you, I think, like up to 15 free school applications, like for your primaries. And I know that not a lot of people know this, but like you can actually have your secondaries waived. A lot of programs, if you like contact the admissions office and you ask if they have like financial waivers, they will either cut down your secondary fee by like half price, or sometimes they have like funds just dedicated for that, especially if like COVID has, like, for instance, impacted you and you're not able to work. They usually have funds available so you don't have to pay for the secondaries, which like cut a lot of my costs. I think I actually only paid for like 3 of my secondaries because they like just ran out of funds for it, but UVM even offered me like a waiver. So you can send like a financial letter to the admissions office, and that's like a great way to cut down your fees. So just like try and utilize that, especially if you're kind of like, oh my gosh, I love all these schools, but I don't know like how I'm gonna afford it, then just ask to have them waived, because they usually are very okay with like waiving it. So look into that too.
Thank you.
That was really helpful.
Yeah, thank you. So I think we have time for one more question, which I've seen a couple of times in the chat, and also like I've definitely wondered about. But maybe you could all just speak on like how you have avoided burnout, or tips that if you have already experienced it, just kind of get past it, because it can seem overwhelming and like a lot to take on from undergraduate into medical school. So just your best ways how you've avoided that or gotten through burnout.
I can start. So I think there's like kind of a spectrum of burnout. Like, yes, you on the lighter side, you're gonna feel tired when you don't get enough sleep. But there's also the extreme side of burnout. It's like, why am I doing this? And I think at some point in our lives, even in high school, college, between college, medical school, or medical school, we probably all been somewhere in there, and you will feel tired. You will feel possibly some burnout during medical school. But I think what has helped me a lot, especially through like 3rd year, when you're going from rotation to rotation, you feel like you're starting a new job every day. It's kind of remind myself like, why did I come here in the first place? And sometimes I just spend maybe 5-10 extra minutes talking to the patient just to get to know them. And that really helps me remember this is why I came here, and to be able to make a difference in someone's life sometimes just by talking to them is huge. And that warm and fuzzy feeling is really what helps me prevent the burnout.
Thank you so much. And so I think on that note, it is 8:29. And so we will wrap up this session for tonight. We want to thank everyone so much for coming. We are so excited that other people are just as eager. And so please follow our Instagram page at VT Reach, and we'll be constantly posting updates. We'll be sending newsletters out for everyone who registered with information on upcoming events. And please get back to us if you have any advice or feedback to how to improve these sessions. We really want to make this something that can be used as a resource moving forward for students in Vermont to look back through and make connections at UVM Medical Center.
And again, thank you to everybody who helped us really get this off the ground. We're incredibly grateful for all of you and all of you who participated tonight. So thank you again. It really means a lot to us. And we look forward to seeing hopefully some of you at the next session.
Thank you.
Thank you. Have a great night, everyone.